Welcome to another episode from the Veterinary Medicine Digest. Today, we are diving deep into the intricate world of canine epilepsy, exploring nuances that often get overlooked in standard discussions, but which are absolutely crucial for understanding and managing this common neurological condition. We have gathered insights from several important research studies that peel back the layers on idiopathic epilepsy in dogs, examining everything from metabolic markers and hidden seizure types to neurobehavioral comorbidities and post-seizure impacts. The prevalence of epilepsy, defined as two or more unprovoked seizures occurring at least 24 hours apart, is estimated to be quite significant in the general dog population, ranging from about 0.50% to 0.82% in various studies. Idiopathic epilepsy, or IE, is the most frequent diagnosis and is presumed to be genetic in origin, diagnosed by excluding structural brain disease or other extracranial causes. Our first area of exploration delves into the subtle metabolic shifts that occur in dogs suffering from idiopathic epilepsy, revealing possible new avenues for therapeutic intervention. The hidden metabolic landscape of idiopathic epilepsy. One groundbreaking study utilized metabolomics, a powerful research technology that characterizes an individual's biological phenotype by integrating host-specific factors like disease and diet to explore the metabolic pathways underlying idiopathic epilepsy in dogs. Canine idiopathic epilepsy is recognized as an established natural animal model for human epilepsy types, sharing clinical traits such as the occurrence of status epilepticus and behavioral comorbidities, alongside similar prevalence rates and pathophysiological properties. A crucial advantage of studying dogs is the ease of establishing a standardized dietary background, ensuring that nutritional inadequacies are excluded when analyzing metabolic alterations. Researchers metabolically profiled plasma samples from healthy dogs and dogs with idiopathic epilepsy, classifying the epileptic dogs into two groups: mild phenotype, or MP, and drug-resistant, or DR. Both the drug-resistant and mild phenotype idiopathic epilepsy groups exhibited a distinct plasma metabolic profile and fingerprint when compared to healthy dogs. The metabolic pathways significantly altered in these dogs pointed toward oxidative stress, inflammation, and amino acid metabolism. One of the most striking and overlooked findings was the observation of significantly lower plasma concentrations of vitamin B6 in both the mild phenotype and drug-resistant idiopathic epilepsy dogs compared to healthy control dogs. The active form of vitamin B6, pyridoxal 5-phosphate, or PLP, was significantly decreased in both the mild phenotype and drug-resistant groups. This deficiency is highly relevant because alterations in both oxidative stress and amino acid pathways could be linked back to this decreased vitamin B6 level. For instance, increased gluconic acid and xanthorrhinic acid plasma levels were observed in dogs with idiopathic epilepsy, mirroring metabolic changes seen in humans. Gluconic acid is considered a marker for oxidative stress because its formation process releases hydrogen peroxide. Xanthorrhinic acid's increase is often a consequence of inflammatory upregulation of the kynurenine pathway, which can lead to functional vitamin B6 deficiencies. When vitamin B6 is deficient, it reduces the conversion of kynurenine to downstream metabolites, causing xanthorrhinic acid levels to rise. The standardized diet provided to all dogs in the study contained vitamin B6 levels exceeding recommended guidelines, suggesting that the lower plasma concentrations observed were likely due to increased utilization rather than nutritional deficiency. This connection between idiopathic epilepsy and altered vitamin B6 metabolism is a new insight in dogs, particularly given that in humans, certain genetic epilepsy types are well known to be dependent on vitamin B6. Furthermore, alterations in amino acid metabolism were prominent. Several amino acids, or their derivatives, particularly alpha amino acids, were significantly increased in the plasma of epileptic dogs compared to healthy controls. For example, glutamic acid, one of the most abundant amino acids critical for metabolism and signaling, was increased in the plasma of some epileptic dogs. Accumulation of threonine, an essential amino acid typically used for energy production, was noted, which could potentially be related to decreased oxidative glucose metabolism, an impairment previously shown in chronic epilepsy rodent models. Another metabolite for guanosinoic acid, or 4GB, showed significantly higher plasma levels in drug-resistant idiopathic epilepsy dogs compared to both healthy dogs and mild phenotype idiopathic epilepsy dogs, suggesting its potential as a biomarker for anti-seizure medication response. 4-guanidinoic acid is considered convulsive, and its presence in the brain has been reported. Increased plasma levels of 4-guanidinoic acid could potentially interfere with creatine uptake across the blood-brain barrier, altering the brain's energy homeostasis and leading to a reduced seizure threshold. The study revealed decreases in protective compounds as well, such as carnosine in drug-resistant dogs, a multipotent protector against oxidative damage known for its neuroprotective effects. These metabolic findings highlight that epilepsy is a complex systemic disease extending far beyond the brain, involving intricate biological processes related to energy use, protection against damage, and fundamental nutrient cofactors. Overlooked seizure presentations, vestibular epilepsy, and subtle focal events. Another crucial area that is often overlooked involves seizure presentations that mimic other neurological conditions. Historically, epilepsy has been primarily associated with generalized tonic-clonic seizures, but research is increasingly uncovering subtle or unusual forms, which pose significant diagnostic challenges. One study focused on defining the clinical features and outcome of suspected idiopathic vestibular epilepsy in dogs, a condition where focal seizures manifest as transient signs of vestibular disease. In humans, vestibular epilepsy is characterized by focal seizures causing transient vestibular signs, like dizziness or vertigo. This study analyzed 10 dogs presenting with recurrent, sudden onset, and abrupt ending episodes of vestibular signs, such as loss of balance, drifting, rolling, and nystagmus, lasting from a few seconds to up to an hour. The difficulty lies in differentiating vestibular epilepsy from other transient vestibular events, such as vestibular paroxysmia. In the 10 dogs studied, certain factors strongly supported an epileptic origin. The presence of additional generalized tonic-clonic seizures in 2 cases, the detection of interictal spikes in the frontotemporal and frontoparietal areas via electroencephalography in 3 dogs, and the universal responsiveness to anti-seizure medications in all 10 dogs. Specifically, the response to anti-seizure medications, with 100% of dogs showing clinical improvement, strongly supported the hypothesis of an epileptic origin. Interestingly, pugs were the most prevalent breed in this small cohort, leading to speculation that they might be predisposed to this specific type of seizure. Furthermore, unlike the short duration, less than 60 seconds, attacks often seen in human vestibular paroxysmia, the episodes in this canine cohort lasted much longer, from several minutes up to an hour. The frequent observation of vestibular nystagmus in the dogs contrasts with its low incidence in human vestibular epilepsy, suggesting potential species differences in clinical presentation. This study strongly suggests the existence of vestibular epilepsy in dogs, with an apparent favorable outcome when treated with anti-seizure medication. In addition to unusual presentations like vestibular epilepsy, many seizures, particularly focal ones, may go unnoticed by owners. A newer, multi-language online questionnaire was developed precisely to capture the variability of seizures and dyskinesia episodes across breeds, addressing the issue of underreporting non-generalized seizures. The questionnaire pragmatically classified paroxysmal events into 5 types, including Type B for non-generalized motor events and Type D for episodes associated with impaired awareness. The results from a large cohort using this questionnaire showed that non-generalized paroxysmal motor events, Type B, were reported almost as frequently as generalized convulsive seizures, Type A. Type B episodes often included signs suggestive of focal epileptic seizures, such as chewing, facial twitches, and unresponsiveness, or signs suggestive of paroxysmal dyskinesia, such as dystonia or lifting of one limb. Disturbingly, owners reported multiple seizure types or paroxysmal events in over 25% of dogs, underscoring the necessity of documenting a variety of seizure types in translational research. For generalized convulsive seizures, nearly 74% were preceded by a focal onset in the minutes or seconds before the seizure began, manifesting as motor, autonomic, or behavioral signs. This highlights that what appears to be a sudden, generalized event often has a subtle, focal beginning that requires careful observation. The importance of precise seizure characterization is further supported by phenotypic differences across breeds. For instance, Labrador retrievers showed a significantly different distribution of seizure types, with non-generalized paroxysmal motor events, type E, being more common, while generalized convulsive seizures, type A, were the most common type in Siberian Huskies and Border Collies. The pervasive impact of the post-seizure phase. Perhaps the most universally overlooked aspect of epilepsy in dogs is the post-ictal phase, the period immediately following the seizure itself. This phase is considered a key defining stage of the seizure manifestation. A questionnaire-based study focused entirely on characterizing post-ictal signs in dogs with idiopathic epilepsy, and the findings underscore how relevant this phase is to the dog's quality of life. Post-ictal clinical abnormalities were identified in over 90% of the dogs studied. The most common post-ictal signs reported by owners were disorientation and wobbliness or clumsiness. Other frequently observed signs included thirst, weakness in all four limbs, lethargy, attention-seeking, fearfulness, hunger, and blindness. Crucially, the study found that post-ictal signs had a greater impact on the dog's perceived quality of life compared with the ictal, seizure, signs. This finding emphasizes that the period of recovery, which can last a median duration of 30 minutes, but ranging up to 72 hours, is a major source of distress for both the dog and the owner. Furthermore, nearly a third of owners reported finding the post-ictal phase to be the most distressing part of the seizure. The signs observed sometimes mirrored those seen in humans, such as deafness and weakness on one side of the body, which are analogous to human auditory disturbances and Todd's paresis or paralysis, respectively. These physical signs are thought to be caused by transient hypoperfusion or reduced blood flow immediately following seizure activity. The post-ictal phase may also serve as a footprint for seizures, as owners reported the presence of suspected post-ictal signs even without witnessing an ictal event in some dogs. This highlights the difficulty in identifying subtle focal seizure forms, where the lingering effects become the only observable evidence. In analyzing the interplay between treatment and recovery, the study found that the administration of benzodiazepines, commonly used for at-home emergency management of seizures, was significantly associated with an increase in the duration of post-ictal signs. This points to the challenge of differentiating medication-related side effects, such as sedation or incoordination, from genuine post-ictal symptoms. Overall, the post-ictal phase is far more complex and influential than a simple period of fatigue, demanding a more proactive approach to its management to improve the quality of life for dogs with epilepsy. Neurobehavioral comorbidities, the emotional and cognitive burden. Epilepsy is rarely just about the seizures. It is a disease associated with significant neurobehavioral comorbidities in both humans and dogs. These changes, which can include anxiety, fear, cognitive deficits, and altered eating habits, significantly complicate the patient's presentation and impact their quality of life. A study characterizing these neurobehavioral changes in 70 dogs with idiopathic epilepsy found that nearly a third of behavioral items assessed showed significant changes after the onset of seizures. The most notable changes were seen in behaviors related to attachment and attention-seeking, separation-related problems, eating behavior, and signs of cognitive decline, such as reduced trainability and dementia-like signs. Specifically, after seizure onset, dogs showed increased attachment and attention-seeking. Dogs had a greater tendency to follow owners at home and sit close to or in contact with them. This clinginess can be interpreted as care-soliciting behavior, perhaps reflecting heightened interictal anxiety. Increased separation-related behaviors. This included restlessness, agitation, pacing, and house soiling when left alone. Altered eating behavior. This included stealing food and emotional eating. Voracity, or excessive eagerness to eat, was also significantly increased. Signs of cognitive impairment. Dogs demonstrated reduced capacity to learn new tricks and an increase in dementia-like behaviors, such as staring into space, aimless wandering, and disorientation. Interestingly, the traditional emotional behaviors of fear, anxiety, and aggression towards strangers or other dogs did not show significant changes after seizure onset in this study, though this contrasts with some other reports. However, anxiety-related behaviors were common and frequently reported by owners. The most significant insight from this study was the identification of two distinct neurobehavioral profiles in epileptic dogs using cluster analysis: the cognitive cluster and the emotional cluster. 1. The cognitive cluster. This group included behaviors linked to learning, trainability, repetitive and demented behaviors, separation-related behaviors, restlessness, house soiling, and compulsive eating behaviors, pica. This profile was associated with a higher total behavioral score, poorer seizure control, and was more frequently associated with drug-resistant epilepsy. These dogs also had lower owner-perceived quality of life scores. This profile suggests that chronic, poorly controlled epileptic activity may profoundly impact brain networks responsible for cognition, with cluster seizures and status epilepticus being recognized major risk factors for cognitive impairment. 2. The emotional cluster. This group encompassed behaviors more aligned with emotional systems, such as fear, frustration, and attachment, including aggression toward family members, fear and anxiety responses, excitability, and attachment seeking. This profile was more frequently observed in dogs with drug-sensitive epilepsy or those who remained untreated and was associated with higher quality of life scores. These findings indicate that the way epilepsy affects the brain is variable and leads to diverse behavioral presentations. Recognizing these profiles is critical for implementing individualized, multimodal care, potentially including behavioral, cognitive, or dietary interventions, in addition to standard anti-seizure medication management. The genetic quest and breed-specific nuances. Idiopathic epilepsy is widely suspected to have a genetic component in many dog breeds, but identifying the exact causal genes or risk factors is incredibly challenging due to the complex nature of the disease. A study focusing on the Dutch Partridge dog, or DPD, illustrated this difficulty by attempting to find risk loci using genetic methods. Although a definitive causal variant was not found, the study successfully characterized the phenotype. Idiopathic epilepsy in the Dutch Partridge dog has a broad range in age of onset, often occurring later than in many other breeds, and most dogs showed focal epileptic seizures evolving into generalized seizures. The study did identify a new risk locus on chromosome 12 and a variant in the CCDC85A gene, which, if homozygous for the variant, increased the risk of developing idiopathic epilepsy by 6.0 times. CCDC85A is an interesting candidate gene because it is highly expressed in the brain and may play a role in synaptic homeostasis and plasticity. These genetic investigations underscore that the manifestations of epilepsy are often breed-specific, necessitating tailored phenotyping studies. For instance, the Irish setter was characterized in one study, reporting that the mean age of seizure onset was 41 months, which is later than many breeds, such as the Border Collie, median 27 months. Almost all Irish setters experienced primary, generalized tonic-clonic seizures. Critically, over half of the population suffered from cluster seizures, which are associated with poor outcomes and warrant early treatment. Furthermore, a strong genetic component was suspected, though the pattern of inheritance was complex and not simply monogenic. A study on a Labradoodle, a popular crossbreed, compared its epilepsy characteristics to its progenitor breeds, the Labrador Retriever and Standard Poodle. The Labradoodle's idiopathic epilepsy had a favorable outcome compared to several other breeds, with high quality of life scores for both the dog and owner. The average age of onset, 2.3 years, was comparable to the Labrador Retriever. A key difference from the Standard Poodle, which rarely experiences them, was the existence of cluster seizures and status epilepticus in the Labradoodle cohort. Over a third of Labradoodles did not require anti-seizure medication, and those who did often had a good response. Owners universally reported stress as the most frequently precipitating factor for seizures, 95% of dogs. The spectrum of seizure response and management varies widely. The Labradoodle has a favorable clinical phenotype with high quality of life scores and many dogs not requiring anti-seizure medication. The Irish setter, in contrast, has a high occurrence of cluster seizures, 54%, mandating early treatment. Border Collies often have lower quality of life scores and poorer outcomes compared to breeds like the Labrador Retriever and Golden Retriever. These breed-specific differences in onset age, seizure type, frequency, and treatment response mean that a one-size-fits-all approach to epilepsy is inadequate. Ammonia and seizure diagnostics, a diagnostic trap. Finally, a significant diagnostic nuance involves the interpretation of hyperammonemia, or elevated blood ammonia concentrations, which is commonly associated with hepatic encephalopathy, often caused by portosystemic shunts in dogs. A retrospective study investigated the prevalence of hyperammonemia in dogs presenting with acute epileptic seizures and found that 10 out of 58 dogs, 17%, had elevated ammonia. Only 3 of these dogs had confirmed hepatic disease. In the other 7 dogs, no definitive cause of hyperammonemia, such as acute liver failure or portosystemic shunts, could be established. This is a critical finding because it challenges the conventional understanding that hyperammonemia in a seizuring dog automatically indicates severe hepatic disease. The study suggests the possibility of non-hepatic hyperammonemia associated with acute seizures, a phenomenon known as post-ictal hyperammonemia in humans and recently reported in cats. Intense and prolonged muscle contractions during generalized tonic-clonic seizures are believed to increase ammonia production in muscles, potentially overwhelming the liver's detoxification capacity. In humans, generalized tonic-clonic seizures and status epilepticus are associated with significantly higher ammonia levels. The implication for clinical practice is significant. High ammonia concentrations after a seizure, especially when other clinical signs of liver dysfunction or neurological symptoms are absent, should not immediately lead to extensive, costly investigations for portosystemic shunts. Instead, clinicians should consider repeating the ammonia analysis to rule out a transient post-ictal elevation. This non-hepatic hyperammonemia may not be associated with a grave prognosis, providing a much brighter outlook for the patient. Failure to recognize this nuance can lead to misdiagnosis and unnecessary, invasive testing. Conclusion: embracing complexity. In summation, the landscape of canine idiopathic epilepsy is far more complex and nuanced than the simple observation of a seizure event. What often goes overlooked holds the key to better patient care. We've learned that idiopathic epilepsy involves profound metabolic alterations driven by oxidative stress, inflammation, and amino acid disturbances, coupled with a surprising deficiency in vitamin B6. This metabolic insight opens the door for potential new therapeutic targets that go beyond traditional anti-seizure medications. We've explored subtle seizure presentations, such as vestibular epilepsy, and the frequent occurrence of non-generalized motor events and focal onset seizures, underscoring the diagnostic challenge inherent in this disease. The post-ictal phase emerges not as a mere side effect, but as a dominant quality of life diminishing feature, often more impactful than the seizure itself, and possibly influenced by emergency medications like benzodiazepines. Finally, the pervasive nature of the disease is reflected in its neurobehavioral comorbidities, categorized into distinct cognitive and emotional profiles, which are closely associated with seizure control and overall quality of life. Furthermore, we must exercise diagnostic caution when encountering hyperammonemia post-seizure, recognizing that it may be a transient, non-hepatic phenomenon rather than a sign of a life-threatening liver condition. Understanding these overlooked complexities is vital for moving towards individualized, nuanced, and comprehensive care for dogs with epilepsy. Treating canine epilepsy is like solving a complex jigsaw puzzle, where the visible pieces are the seizures, but the truly challenging and critical connections, the metabolic imbalances, the subtle seizure types, the post-ictal impacts, and the hidden behavioral burdens, are revealed only by stepping back and examining the entire picture provided by these comprehensive studies. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging,